Today we're going to use this time to discuss the concept of the patient box. The patient box is part of the assessment tools that are outlined by the Integrated National Board Dental Examination, which our students are set to begin taking after next year. And one of the things we have to do is prepare our curriculum so that the students grow accustomed to having to navigate doing more case-based questions. As such, we are instituting a mandatory approach where everyone has to include at least one patient box in an examination starting this fall in each one of their courses. So if you have a course that gives any type of computerized or written examination, of course we already require that everyone gives an exam via ExamSoft. So in addition to that, now you'll actually have to make sure you incorporate at least one exam that has a patient box within it. So what is this patient box and what is this all about? Why are we doing it and how exactly can it be done? So what we'll start with focusing on is the fact that the Integrated National Board Dental Exam, which we'll just call INBDE for short, is replacing the National Board Dental Examinations Part 1 and Part 2. And this is, of course, overseen by the Joint Commission on National Dental Examiners. And the JCNDE is responsible for developing all national board exams. Part 1 and Part 2 was developed back in 1933 and 1934. And now the integrated part is actually being developed and was launched in 2020, August 1st to be exact. So now we're going to focus our attention on how do you develop a patient box and why is this important. So the reason this is important is because 70% of all of the questions that are going to appear on the INBDE are going to be associated with a patient box. So we need to make sure that the patient box and all the categories that the patient box should have are discussed. So what we'll look at is each component of the patient box and how we can complete them. What does a good case look like? And, how can we navigate this very daunting task, this seemingly insurmountable task that may really be inconvenient because, let's face it, we've not had to change up our curriculum to this degree ever before. So what I've outlined for you is a top 10 countdown for how you can successfully create a patient box and all the components that are needed. So let's start off with number 10. Number 10, find a good case that has x-rays, clinical photos, or an odontogram if possible. You don't have to have these features because on the INBDE, they are going to have questions and patient boxes that actually won't have any photos or x-rays or an odontogram with probing depths, etc. But if you can have that information, that's going to bolster the case and the experience for the students so that they're now not required only to read and interpret, but they're actually required to interpret based on the images that they see and have to draw some key conclusions. So if you have a good solid set of photographs or radiographs that you can pull from any number of sources, whether it's a patient that you've seen in the past or patients that we've seen based on what's within our electronic health record, that would be a great resource that we can use to have patient boxes. Number 9, provide a gender and an age. Ethnicity is optional. So this is important because the gender and the age is going to frame the overall mindset that the student is going to have as they approach the case. However, ethnicity can also add some very meaningful information at times. What the boards is trying to get away from is having an ethnicity that is irrelevant to the case. So only if there are instances where ethnicity is needed will you actually need to put it. If it's going to actually add some information that may help cue the student in while they're looking at the question, then provide it. Otherwise, an ethnicity is not required. This is also the section of the patient box that you would include information about the caregiver or a parent or any guardian that may be accompanying a patient. So of course, not every case is going to always be the patient themselves presenting to the clinic, but there are instances where someone may accompany that person, and this is the area where you can go into that detail. Number 8, define why the patient is seeking dental care. So of course, this is our chief complaint. The chief complaint is going to always and should always be stated in the patient's own words or the guardian's own words. This is important and is always supposed to be quoted. So the chief complaint should appear in quotation marks. This is going to guide the student in recognizing the whole purpose of this visit and the whole purpose of why they're here today. However, the patient box may have a chief complaint that may actually be a symptom that's not addressed based on the line of questions that are asked. However, the chief complaint is still an important component. So be sure to outline what the chief complaint is. Number 7, determine a background and patient history. This is actually a section that, according to the guide, you can actually leave blank. But generally speaking, this is not left blank. So what we want to try to do is have all the components that the background or the patient history may include. So those components may include medications, medical conditions that the patient may have, dental history or diagnosis that's relevant to the dental, and the social history. Now, you may not have all 4 components. You may just have one, or like I said, you may have none whatsoever. But the key here is that this is the area where you list this information. The medications go here. The medical conditions are listed here. Any dental history, any dental diagnosis, and any social history. Number 6, refer to medications as both generic and trade names. What we want to make sure we do is not just focus in on a trade name at the risk of a student being familiar with the generic name or vice versa. So be sure to always include both when you're referencing a specific medication. Number 5, provide current findings. Your current findings may include your height, the weight, the vital signs, and any diagnostic test results. You do not necessarily have to provide a height and a weight, but there are some instances where perhaps you want the student to recognize a appropriate BMI for a patient. You may want to provide a height and a weight. The vital signs, such as your pulse, your respiratory rate, and your blood pressure, can also be listed. However, if you don't want to emphasize this and everything is pretty much stable, you can actually say that the vitals are stable or within normal limits. Similarly, you can say the same for any assessments of the patient's condition. Number 4, develop good questions, and these are called stems. A good question should not just duplicate information that's already listed within the box. Also, however, a good question should require the student to refer back to the patient box in order to be able to answer it. If a student can answer the question without referring to the patient box, then it's really a standalone question. And as we've already learned, only 30% of the questions on this examination will be standalone questions that do not have a patient box. So be sure to have a good sound stem when you write your questions for the patient box. Number 3, list reasonable distractors. So your distractors are part of the ABCD choices that you're going to provide. And of course, one of those choices is the correct answer, but 3 or 4 of those, depending on the number of distractors you've chosen, will be considered distractors. The key here is to make sure that the distractors are similar in length and are at least plausible. If we were asking questions about which teeth numbers were missing, we wouldn't want an answer choice that consisted of, is it tooth 1, 2, 3, or 104? Because since the human dentition only has 32 teeth, 104 would be an irrelevant answer that would be so extreme it's obvious that that doesn't fit. Number 2, collaborate with peers and other disciplines whenever possible. So once you've actually developed your patient box, have a colleague take a look at it. Have them give you some feedback. And you may even consider having them draft questions specific to their discipline to be contributed to that patient box. This will actually help the students have to think in a multitude of ways, as opposed to just focusing in on one discipline specific to your course. Now they'll have to be able to shift gears and focus on other disciplines as well, because this is exactly how the Integrated National Board is going to deliver questions to them. They do not complete the examination one section at a time. Instead, they complete the examination with a jumbled up series of questions, not knowing which discipline is going to be thrown at them next. Number 1, decide which foundational knowledge and which clinical content category this question that you have written addresses. So be sure that the FKs or the CCs are identified. You may have more than one FK and more than one CC to a given question. That's fine. Just be sure to identify those and mark those as such. That concludes our top 10. Like we said, identify a good case with x-rays, clinical photographs, and odontogram. Number 9, provide a gender and an age, and the ethnicity is optional. Number 8, define why the patient is seeking dental care. This is the patient's chief complaint. Number 7, determine a background and a patient history. Number 6, refer to medications as both generic and trade names. Number 5, provide current findings, such as height, weight, and vital signs. Number 4, develop good questions and try your best not to duplicate any information that is already listed within the patient box within the stem of your question. Number 3, list reasonable distractors. Number 2, collaborate with peers of other disciplines. And number 1, decide which FK and CC categories the question you have written addresses. For additional questions that you may have, please feel free to refer to the INBDE Developer's Guide released by the JCNDE on the ADA website. This concludes our training on the patient box. More discipline-specific areas and more details about each category of the patient box will be provided in a detailed training in which everyone will have an opportunity to practice in a workshop type setting. Thank you.